Dr. Amy Lee, Chief Medical Officer for Lindora Clinics. I'm here today to reintroduce this program that we call HRT in our business, and we're basically expanding our services to many more locations that is already in place. But before that, I want to introduce you to our new addition to the team. Her name is Dr. Sarah Amir, and I'm going to ask her on the details and specific of what HRT is about. But before that, I'm going to let Dr. Sarah introduce herself, give us a little background on what she's about and why we're excited to have her here at Lindora.
Hi, I'm Dr. Amir. I've been working in telehealth and hormones for the past 5.5 years. This is my area of expertise. So I'm really excited to build a foundation and help as many patients as we can through Lindora achieve their journey and reclaim their life with their hormone replacement therapy.
Let's dive right in. Let's talk about HRT. Number one, what does it mean and how does that relate to our patient population?
So HRT means hormone replacement therapy, and when your hormone levels decline, weight loss becomes increasingly difficult. So supplementing with estrogen and progesterone and testosterone in women helps, and definitely testosterone replacement therapy in men can help rev the metabolism and really just highlight the body's natural mechanisms to help you burn body fat.
And for females?
For females, same thing. Females, they need testosterone just as much as men, just not as much.
Okay.
And without that, muscle recovery, muscle mass, muscle gains, it tends to, they're not able to really achieve and sustain their muscle.
Well, let's talk about our patient population, and we've been in business for 50 years for purely weight management, but we are expanding into what we call metabolic health. We are coming across a lot more patients who are really asking for that additional help with various conditions. What would you say would be the most common symptoms that our female patients would encounter, which would reflect evidence of imbalanced hormones?
Yes, women typically are going to experience an increasingly difficult time to lose body fat when their estrogen drops. Their sleep is going to become disturbed when progesterone is low. Their moods are going to shift, and they're going to experience anxiety, heart palpitations, night sweats, also disturbing their sleep. So all of these things combined can essentially hinder the metabolic rate, hinder their overall approach and vitality in life. And by restoring these levels, we can give that back to our patients.
Okay, let's talk about our men. We don't have too many in our business, but we hope to see more. Now, I think sometimes men are just a little shy to come into one of our clinics, but what are some of the most common symptoms that our men usually encounter or suffer from when there's an imbalance of hormones?
Yes, when testosterone levels decline in men, typically they're experiencing erectile dysfunction, lowered libido, difficulty gaining and achieving muscle mass, athletic performance and recovery tends to reduce, libido can reduce, and overall mental performance, endurance, difficulty with recall, concentration, all of these things can be affected when your testosterone levels drop in men.
Perfect. Well, I do feel that HRT plays a super important role in weight management. I think sometimes it's hard for us to tease out for every individual. So is there like a perfect age range that we should be thinking about when it comes to hormone replacement, or is this something beneficial for everybody?
That's a great question. Typically, nowadays, hormone levels are declining as early as age 26, but we start to notice the need for replenishment for men as early as age 35. On average, it used to be 50 years old, but now we're seeing numbers drop lower and lower, so around 40 is a good time to start. For women, onset of perimenopause is now starting to be seen around age 40, so it's good to get your labs checked as early as age 40, even 35. Typical age of menopause, that's around 52. And menopause is defined as not having a menstrual cycle for at least 12 months minimum. So around those ages are a great time to get your labs checked. And even when you're younger, getting data on what your body looks like when you feel your best in your 20s, 25, 32. That way you have a comparison of what your levels are like when you're older and to what you specifically felt best at.
Well, as a physician, I know that in my medical community, there's still a lot of negative, controversial information out in the space when it comes to hormone replacement. How do I, as a consumer or a patient, be able to figure out who is my right provider? Like, what kind of training is needed for this type of practice?
That's a great question. Not everybody is qualified as a hormone replacement therapy specialist. Not to knock on anybody else's profession, but I would find someone that's been doing it for a long time and that's all they do all day, every day is hormone replacement therapy. And that way you can find the best care. Researching and finding someone who does bioidentical hormone replacement therapy, that's going to be your more safer alternative to make sure you get the care you need, but also not put your body at risk for further conditions later on down the line. And that's why I'm happy that we at Lindora do bioidentical hormone replacement therapy as a safer means.
So can you tell my patient how to get connected with someone to learn more about HRT?
Absolutely. You can visit our website at lindora.com. There is an informational quiz online that you can take to determine if you can qualify for our hormone replacement therapy program. You can call any one of our clinics or just walk in and ask any one of our clinician staff, and they can help you with that.